Welcome to the MamasteFit Podcast. In this episode, Roxanne, we're going to be talking about the polarizing views of birth that you may encounter on social media, maybe with your medical provider or even your non-medical support. And so we're going to discuss why it's important to have an open mind when it comes to birth, not only for yourself, but also for your support team. Welcome to the MamasteFit Podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit Podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit Podcast. In this episode, we're going to be talking about the extreme viewpoints on birth and how you can be on one extreme that's like super medicalized versus the other extreme, which is like you should have no interventions and give birth in a field with dolphins and all sorts of stuff. And so obviously those two extremes are not where most of us are going to be. We're going to be more towards the middle. And it's important that we have an open mind when it comes to birth. And then the people that are supporting birth also have an open mind as well, that there's no one way that everyone needs to give birth because one, not everybody wants to give birth in the same exact way. Not everybody wants a home birth. Not everybody wants an unmedicated birth. Some people do want a home birth and unmedicated birth. Like not everybody wants to give birth in a hospital. And so being open to understanding that different people have different desires for their birth is going to be really important. And we all have different medical situations where giving birth at home is not a great option for every single person just based on the medical stuff that they got going on with themselves as well, or complications they may have with their pregnancy. And so there is no one way that every single person should give birth. And when we have these really polarizing viewpoints on birth, it makes folks that don't fall in to either of those feel like they did something wrong, when something worked better for them. So with the two extreme viewpoints, the reason that they can be almost like harmful in a way is that it makes it, again, seem like you did something wrong and that the other side is the wrong side and that we're on the good side. Whether you're on like everyone should deliver in the hospital with an elective induction at 39 weeks with every single medical intervention. If you to choose anywhere else, you are silly because this is the safest place to be. And then there's the complete opposite side where like everything you should just deliver at home by yourself. Your body can do this and you can just trust your body, your baby out in a field surrounded by angels singing in the background. The two views, like again, like somebody who has severe preeclampsia should probably not be delivering at home because there are lots of complications. And that is why the medical system is there for those people who do have these medical complications or don't want to give birth unmedicated. That hospital is there for them as that option with all of these tools that are available to you. But when you view the hospital as this like evil place who's out to get you and take away all of your rights, or you view the hospital as the only place and that you need to control birth because it's this scary thing that everyone, like only sick people are going to be in the hospital. So like you're here having a baby. So like I'm going to help fix this and help solve this problem. That is a harmful view, but so is like, if you accept any intervention, this is harmful for your birth. If you get Pitocin, this is harmful for you and your baby, and you're making this terrible choice that no one should ever say yes to. This demonizes all of these helpful interventions that could potentially be beneficial for people, but they're fearful of these interventions that they might need, and then this harms their birth process as well. If you're fearful of like Pitocin, but you developed severe preeclampsia, or your water broke and it's now been 2 or 3 days and nothing has happened and labor needs to start or else an infection might develop, but you're fearful of Pitocin, this is going to harm your body feeling safe to actually go into labor. So let's talk about my first birth then, because we were kind of at our own like little extremes at that point, navigating my first birth experience. You were a newer labor nurse. I had no idea what was going on. I took a course that made me terrified of the hospital. You know, you've got the documentary like Business of Being Born, where on one hand, yes, it is really helpful to understand like there are other things that may be influencing our care. Not everybody needs to be induced. Not everybody needs Pitocin or every single intervention. Hospitals are not necessarily like the safest place for every single person. They are the safest place for some people, though. Like if you have a severe complication, the hospital can be very beneficial. Now, is there a business when it comes to like our medical system? Absolutely. And so like I watched that documentary. I took a childbirth ed course that just like scared the shit out of me. And it was like, Pitocin is bad. Getting an epidural is bad. All these interventions, like if you get them, you're harming your baby. And like essentially made me feel like if I chose them, I was less than as a mother. Like how could I possibly choose something for my own convenience and hurt my baby doing it? It was essentially how I left that class. And so I got towards the end of my pregnancy and my provider, which I do think that could have been a better conversation. I showed up at my 40-week appointment and they were like, all right, your induction is scheduled for 41-3. Will you call the morning of and we'll see you then? And I was like, what do you mean? Like, where can we have a conversation about but I didn't say that. I was like, okay.
Yeah.
But like,
that also shows you like people are fearful to speak to their medical providers because they feel like they're like above them because they have this medical degree and they know everything. But they're just like us, like speaking to them as if they are your equal. I think one of our friends says that like you're paying them for a service. So like if you are unhappy with the service, like you need to get more out of them because if they tell you something and they don't answer your questions, like that you're not leaving a satisfied customer.
Yeah.
So
what I should have done in the situation that I felt in hindsight and now with more experience where I knew would not have been a confrontational thing to do because I was afraid of conflict. Like I don't want my medical provider to think that like I don't trust them or that I'm dismissing their educational background because, you know, they do spend a lot of years learning a bunch of stuff that I don't know. Like what I should have said in that moment was like, hey, I understand that it's your policy to schedule inductions and maybe I didn't know that. And I was like, I understand that it's the policy to schedule it for this date, but I feel really uncomfortable about it. Like I'm really nervous about having to get induced and this is creating a lot of stress for me right now. And then hopefully that could have initiated a conversation of like, well, let's discuss like what we can do to make you feel less anxious about this.
Yeah.
I don't know if that provider would have been the person to respond well to that, but in hindsight, like I should have been like, hey, this makes me really anxious. And so what I did instead was like, okay, and then I left my appointment, but now I'm like stressed out because I'm like, I don't want to get induced because all of the interventions with induction are so bad for me and my baby. I want to have this unmedicated birth. At this point, it's like way too late to even try to find a home birth provider.
40 weeks.
Like that was not going to happen. I actually didn't even know how to find a different type of provider at that point. And with the insurance that I had and the job that I had at the time, I didn't really have another option. It wasn't like I could just go find somebody else. Also, I was 40 weeks pregnant. And so I'm on one end of the extreme where I'm like, all interventions are bad. I'm not supposed to take them. This is not from any experience that I have with birth. It was from a childbirth ed course that I took that essentially scared the shit out of me.
Yeah.
And so then I go to you and I'm like, hello, medical person. Please help me with my fears. And your response was, what's the big deal? It's just Pitocin. Because it's something that you're familiar with. You're like, this is just what people do to get induced. Like induction is not a big deal.
It's
and
not
I'm
a
like,
scary thing.
But
like,
for me, it was a big deal.
Yeah.
I was like, so what I should have done to you is like, Roxanne, I feel very anxious about this right now. Help me, talk me off the ledge. But instead I was like, okay, I shouldn't talk to you about it because you don't want to listen. You're gaslighting me. But that was like an example where we were at two extremes where like if we had more of a mutual understanding of like how I might be feeling in this moment, like being super anxious, and I communicated that better, and that you had an understanding of like, hey, not everybody wants to be induced. Not everybody is comfortable with that. And like Gina just took this course that scared the shit out of her. Like maybe I should try to explain to her like you don't have to go just because it's an elective induction. Like, you can just, like, I mean, at that point, maybe
it wasn't an elective induction.
Maybe it was a medical one.
41 and 3.
But like, we could have talked more about like, what is Pitocin? Like, how do they administer it? Like, it's not usually 0 to 1,000. It's like a slow like increase. You can always turn it off. This is how you can ask to turn it off. And so like, if we had both been more in a middle ground where I had either been understanding like, okay, not everyone needs every single intervention. Like, however, some of us do need some. Some of us, we decide in our own birth that this intervention makes sense for me. Whether or not somebody else would choose the same intervention in that moment doesn't matter. For me, in that moment, this is what I'm choosing, and I feel supported in making that decision based on the information that I have, the education that I've had, and what I understand works best for me and for my family. And so if we had been in a middle ground and we both had this mutual understanding, I would have probably gone into labor which I did at 41 and 3 or 2, 41 and 2. But I was so stressed out that whole early labor that I was still going to be pregnant like the next day, and they were going to induce me. Even though like I would have just continued to be in labor. Like, they wouldn't have induced me just because I was at 41 and 3. Like, I would have just been like, hey, I'm in labor. I'll show up when I'm ready, kind of thing. But I didn't understand that because I was so terrified of Pitocin.
Yes, and I was not communicating that in an effective manner of like, hey, you just not go. And you're just like, what do you mean I can't just not go? Like,
what do you mean?
They're gonna come for me.
They're gonna come
and
get me.
Like, I mean, if you don't want to go, just don't go. But then I would like go on a rant of like, these are all the risks of like going past 42 weeks. So
Your
like,
placenta's gonna die.
Yeah,
it's like
there's an increased risk going past 42 weeks, so you don't want to get there. But like, you can just not go. Like, they're not gonna come to your house.
And so for us now as childbirth educators and as birth professionals, from that experience, I understand that there can be a lot of anxiety and like fear mongering from both sides, like just scaring people when it comes to birth. And so if we can understand like what are you afraid of and how can I explain it to you to help you not be afraid of it? Not in a way to convince someone to do what I think is right.
Yes.
Because my own like personal preferences for my birth are not even the same as yours.
No.
And that's fine. Like, there's nothing wrong with you wanting to give birth in a hospital because you feel most comfortable and confident there. Well, like, I want to give birth at home as long as there are no complications for my pregnancy. But for me, it's not home birth or bust. Like, if I risk out, like, I'll give birth in a hospital because that's going to become the safest place for me and my baby. But that's not the same decision that everyone would make. Some folks are like, I'm going to give birth at home no matter what, too.
Yeah.
And so when we're teaching our childbirth education course, we're trying to explain what it is, like, what is this intervention? Why is it usually recommended? And what are your options with it? Because typically, even with any intervention, there's some sort of options with it or an alternative or even an option within it. So Pitocin, for example, there are alternatives that you can try first. But even if you do receive Pitocin, there are options when you get it. Like, you can have your nurse turn it up slower if you're feeling anxious about it. Like, you can have it turned off if your contractions start getting too close or you just want to break from it. So there are options with it that not everyone realizes that they have. Like, I didn't know that you could just turn it off and go to sleep and then wake up and restart if it's just not really kicking in for you at all. Like, it's maxed out all the way and it's like, well, maybe we need to take a break from it. And so understanding not only what are your alternative options, but what are your options with that intervention, and then helping folks understand what are the risks and benefits of each option, because there are risks and benefits to everything. Nothing is risk-free, to include doing nothing. There's also risks to doing nothing as well. And so, like I said, instead of educating in an attempt to convince somebody to do what I think is the best type of birth ever, there is no one best type of birth. Educating somebody so they feel empowered to make their own decisions based on their circumstances, what their preferences are, and so they feel confident navigating their own birth. So when they make maybe a different decision than what most people do, they still feel good about it. Because I felt super guilty when I got Pitocin, and then when I continued to mentally spiral because there's a lot going on at this point. And then I got an epidural, and my doula was like, I think it was a really good choice. And I was like, oh, thanks. Like, that makes me feel not better, but I'm going to pretend it does and tell myself that I feel better about it. But then I felt really guilty about that too, because I was told that these interventions are really bad. And had I had a different mindset, like that birth would have been way less like traumatic for me, because I would have been like, oh, Pitocin is maybe something that I need right now. Or you know what? I don't feel comfortable with it. I'm going to advocate for myself that I don't want it right now and that I will just continue to be in labor. And then when it, I probably wouldn't have mentally spiraled and like gone down this like rabbit hole of despair and then gotten an epidural. Like maybe I would have gone unmedicated. Who knows? Maybe an epidural.
No one will know.
An epidural was also a really great nap. And so I was like, well, that was kind of nice.
There are positives and negatives to every intervention or every choice you make during your laboring process. Like, it's not like everything is like that. You could find like a positive spin on pretty much every decision, or like convince yourself that it was a positive spin. But with the biggest thing that like one from your story that I obviously hear being a part of it, but it's understanding the risks and benefits and being able to make that choice yourself, rather than somebody telling you, hey, we're going to start Pitocin on you. One, that's like not consent. But like giving you the choice to be a active participant in your birth and be able to empower yourself to say, yes, we'll do Pitocin because that seems like the best decision for us in this moment. Or, hey, we'd like to just go home and see if maybe this progresses. Because if you don't know all of the options that you have in birth, and then knowing the risks and benefits, because again, like even just going home, there's always risks with just going home. You can like deliver on your way home. Like there's always things that could happen. But like by you choosing it and being that active participant, it leaves you feeling more empowered in that birthing process rather than fearful of the two polarizing sides. Like, we're not saying like one type of birth is perfect. It's the perfect birth is the one where you feel empowered and that you feel confident in all the choices that you are making during it, and you feel supported by everybody involved. And by learning all of the options available to you, or just expressing when maybe you are confused or anxious or fearful of anything within that birthing process, like whether, again, you're at home or at a birth center or at a hospital, they're going to offer potentially interventions, and knowing them. And if you are fearful, expressing that you are fearful of that, for them to then explain it to you in a way that makes you less fearful of them, that is the best. That is the best birth.
Let's take a break from this week's episode to discuss our podcast sponsor, Needed. Needed is a nutrition company that specializes in optimizing nutrition for the perinatal timeframe. So you can use them during your pregnancy, during your postpartum, your preconception. They have a ton of support for you nutritionally throughout this timeframe.
So we're talking about options with birth, and prenatal vitamins is probably the one thing you're going to hear about a lot. And Needed has 3 different options for you because not every prenatal is the right fit for everybody. There is no perfect prenatal for everyone. So they have their prenatal multi-capsules, which is 8 capsules that has a ton of optimal nourishment. And then there's a powdered option. So their prenatal multi-powder. And this is a really great option for first trimester, or if you don't really like taking a lot of capsules, that is a great option where it still has a lot of those nutrients that we need. But if, again, the powder is too much, the 8 capsules is too much, they have a third option, the prenatal essentials, which is only 3 capsules. So it's a lot more manageable versus the 8 for a lot of people.
In addition to their prenatal vitamins, not all of us need all of the same type of supplements during our pregnancy as well. And so they have add-on options as well with choline, with iron, with vitamin D. And so they have additional supplements that you can grab depending on what you individually need, which we are incredibly supportive of.
And then if you're looking to find like maybe the right prenatal vitamin for you, and maybe if Needed is not it, or you just want to compare Needed against the other prenatal vitamins that are on the market, they have a prenatal vitamin guide that breaks down over 100 prenatal vitamins that we'll link in the show notes below. If you want to either grab their prenatal vitamin guide or you want to buy some prenatal vitamins from Needed, you can go to thisisneeded.com and use our code MamastePod for 20% off your first order or the first 3 months of a subscription.
So we have a lot of folks that'll message us after taking our childbirth education course and then after having a birth that was unexpected for them. Because I think most folks have like a vision in mind when they go into their birth based on either like stories they've heard, like videos or pictures that they've seen, or maybe they've just created this like ideal birth in their head. Not all of us end up with that like perfect quote unquote like birth where like your labor is really easy and then you just breathe your baby out and they just fall into your arms. And it's like, I think all birth is really beautiful, but all of the things that we like hope for don't always happen. Sometimes it does.
Owen's was true.
I feel like Owen's birth was like what I would define as like a perfect birth. And like my other ones were great too, but like his was like I wanted to wake up in labor and then labor during the day. And then my friend was going to come over and give me a massage. And then we were going to go for a walk.
Second births, man. Those were the...
And then he was born at like 9 p.m. and it was great. Like if the early labor was a little quicker, that would have been wonderful. But a lot of folks will have this like ideal birth in their head. And I think it's totally fine to have like a dream for your birth. Like I don't think there's anything wrong with that. Some people are like anti-birth dreams. And I'm like, I don't know. I think it's kind of cool to like figure out what vibe you're looking for and then set the parameters to achieve that. But we'll have folks that'll message us and they'll be like, hey, like I did not have the birth that I envisioned for myself. However, I felt very confident navigating each step of the way, even though things changed. I still felt like I kept control. Like not like you can't control birth, but you can control the decisions that are made during your birth. And so they all usually will say, I felt very confident navigating each step and that I got to maintain my autonomy because I was able to continue to make decisions during my birth. And I felt confident with changes that happened. I understood that it was okay and that I wasn't failing and nothing was wrong with my birth. And that is always like really wonderful to hear because I think that's our goal with our childbirth education course is to provide people the information so them and their families can then make decisions that work best for them in the moment. Because like what you and I would do in the same scenario can be different and going to be different from other people. And so it's really awesome to hear that they say, in this moment where I had to make a different decision than what I was planning, I felt really good about making a decision, even though it wasn't exactly aligned with my ideal birth. And so these are people that were hoping for spontaneous like labors with vaginal deliveries that ended up having to get induced and then they navigated their induction, or folks that ended up having C-sections that were not planning to have a C-section. And none of those births are bad paths to take, but if you demonize those paths where you say, no one should get induced, Pitocin is so bad for you, like no one should get a C-section because C-sections are horrible for you, like then when people have those paths, even though those are the best paths for them, then it makes them feel like they failed somehow. And I hated feeling like that during my birth, where I felt like I had failed somehow. And I don't want other people to feel that either. And I know the reason that I felt failed was because I had been told that there's this one way that I'm supposed to give birth. And when I didn't do it that way, I was like, well, shit. Like, what else am I going to fuck up
But then
now?
you also, from the opposite side, like you didn't feel supported.
Yes.
Like the medical system, because they didn't kind of help alleviate those fears that you're having. So like the two views on both sides were conflicting. So it couldn't bring you back to the middle.
Like I asked the nurse if I could turn off the Pitocin because I was like, they're close. Like I feel like
I remember this.
I feel like I'm good. And Roxanne was laying on the end of the bed and I kicked her and I was like, because I was like, Roxanne, when we're all exhausted. It's like 4 a.m.
When do they turn the Pitocin off? And I was like,
They don't.
They don't.
And I was like, well, that's bullshit.
Literally
so then
verbatim,
I called
that's
the
what
nurse
Gina said.
in.
That's bullshit.
I was like, I would like to turn this off. I would like to not have this anymore. And she was like, well.
She's like, we don't do that.
I guess I'll go grab the midwife. Like it was not a supportive tone. And then the midwife came in with her arms crossed and was like, I heard you wanted to talk to me. And I was like, I sure do not want to talk to you. And then I spiraled. Like within half an hour, I was like, get me an epidural. Like I cannot mentally deal with like the unsupportive staff that I'm dealing with right now in this environment that I did not expect to be in. And so it is two-sided where I was like, everything is bad for you and interventions in the hospital, they're evil. But then it was reinforced by this staff that was not willing to like be supportive of me. And so that was like the big reason why I switched to home birth for my subsequent births was because I needed to have a provider that supported me. But you can have that in a hospital and you can have that in a birth center. Like it doesn't have to be home birth to have a provider that is supportive of you because we have hospitals here that I'm like, these providers are very supportive, and they do tons of like informed consent. And even providers at that same hospital like do tons of informed consent. I just had somebody who was having a very bad day. The whole staff that was having a very bad day. And so for me, switching to home birth was like a really beneficial thing for me to do, because I had a provider that I can trust to then help me navigate hard situations should I need to move through them. Even like and I knew like, okay, if for whatever reason I risk out of home birth, I'm going to transition to a different provider that also is like very supportive of helping me navigate hard decisions that I can trust. And I think that was a really big thing for me. And so it helped to reinforce my trust back in the medical system, because I was like, well, my first birth, all these providers and nurses are evil. No offense, Roxanne. And then I became a doula about a year later, and I still had a little bit of this like stagnant trauma from that birth experience. And so I am trying to navigate being a new doula with also trusting the medical system, because that's where all the births were that I was supporting, without feeling like I needed to fight every single person that entered the room.
And that makes it hard when you show up to support a birth, or like you are in labor and you feel like you're going to have to fight the medical staff throughout your entire birth. When most people, like no one goes into birth work like as an OB provider, as a midwife, or as a labor nurse, and like being like, I'm going to just ruin people's birth experience and make them take all these interventions because like they don't know what they're doing. Their bodies can't have babies. No, they go into it because it's like a beautiful experience to be a part of. Like being welcomed into somebody's birth experience is like, this is something that most people will remember their nurses or remember their doctors for like the rest of their lives, for good and bad experiences. And so people like, we know that this is a big deal for a lot of people, but sometimes like if you do it for a really long time, sometimes you get a little like you forget that it's such a monumental moment for people, and you have to be reminded. But like they're there to make this experience beautiful. They want it to be beautiful for you. Sometimes they just forget. And so they need reminders like, hey, this is kind of, I don't do this every day. Like, can you help me? Yeah. I'm a little afraid. And then they're there to help alleviate that fear. So with the two views, I think it's important to know, if you like look into yourself, either if you're a birth worker or if you are someone who's about to give birth, like what side do you feel like you lean towards? And then like realizing and acknowledging your bias. So like obviously you have definitely more of a bias towards like, you lean more towards that no intervention type birth. Whereas I am a medical provider, I'm going to lean a little bit more towards like interventions are there and they're helpful. And it's like sometimes you need them, and we shouldn't be fearful of them too much. But they come with risks. So like I acknowledge my bias, and I know, and like when I go into births, like I have to be more open-minded about different things because I know I do have a little bit of a bias. So like acknowledging your bias as either a pregnant person or a birth worker in general is so beneficial, because we all have biases, whether or not you acknowledge them or not. Like we all have a bias. And this, if we don't acknowledge our biases and learn what our biases are, this could potentially hinder the care that we can give people, or like hinder our ability to give birth. Like if we're like all up in our head, because we have to like during labor, you gotta surrender a lot. And if you're not surrendering your biases, it could hurt your labor.
So I think when it comes from the birth worker's perspective, because we're both birth workers, we both given birth, and so we'll talk about birth workers and then we'll talk about like the parent perspective. So from the doula side, usually doulas are leaning towards the low intervention, more like crunchy side of the spectrum, just based on we're non-medical providers. We do not,
you can't give
in
Pitocin.
Our toolkit, we do not have medication to give. Yeah. We shouldn't, at least. Like we don't have medical tools to provide. And so because of that, we have to more heavily rely on more holistic remedies to help with issues during a labor. So if someone's having a labor stall, I'm not going to be like, let me give you Pitocin. I don't have Pitocin to give. It's not going to be,
it out of your pocket.
It's not going to be a recommendation that I'm making. It's not one that I'm going to be like asking the staff to give to them. Like, hello, I would like you to order some Pitocin. But what I have in some doulas do step outside. Anyways, But in my toolkit, I have different movements that we can do. Like, can we do some fear releases? Can I support you emotionally so that you're less afraid of labor to maybe help with like the labor stall? I can identify like what type of stall it might be based on the fact that I'm sitting in the room with you the whole time. And I can see subtle cues that maybe the nurse, the midwife, the provider haven't been able to see because they're kind of popping in and out because they've got other patients to take care of. And so I have different types of tools in my toolkit to utilize, and none of them are medical. And so, of course, I'm going to lean towards the lower intervention side. But as a doula, it's also really important to acknowledge that there are times when intervention is needed. Not everybody will need an intervention. There's plenty of labor stalls that I've helped resolve with just movement and fear release alone without any sort of additional intervention. But there are some labor stalls and some like complications during someone's birth where they do need an intervention. And that does become something that we start discussing and talking about. Like, hey, like I understand like, this is the type of birth that you were hoping for. However, like your water has been broken for like a longer period of time and your labor is not progressing. Like we probably should consider like transferring at this point to the hospital so that you can get the type of interventions that you need. Or, hey, your contractions are like super spaced out and they've pretty much stopped, even though you're like 9 centimeters. Like you're at a slightly higher risk for hemorrhage at this point because your uterus is maybe not doing what it's supposed to be doing. So like a transfer would be like a good option. And now I'm not the one recommending transfers, and I'm not the one necessarily recommending medical interventions. But like if the staff starts to bring them up, then it does seem like this is probably a good idea based on the circumstance, like discussing with the family of like, hey, this is like our intervention that they're recommending. These are some reasons why it may be really beneficial for you right now. These are some other options that we can explore and how effective these other options are. Like, if you want my opinion on like what I may do in this situation, like I'll give it to you, but I'm here to support you in whatever you guys choose to do. Like, this is just what it is. Like, understand that it's not evil, it's not bad. And so being open to also understanding that there are times when someone does need intervention can be really beneficial as a doula as well. Like, yes, utilize all your holistic tools, share them with the staff. Like, if you have an opportunity to like educate a nurse on like a labor position, why it's really helpful, because that's something that I'll do a lot. Like if somebody asks, like I'm not like, hey, sit down, let me teach you like some movements. But if they're like, oh, why do you have her leg like that in this position? I'm like, oh, well, this is what's going on with the pelvis when we orient the hip like this. And they're like, oh, that's really cool. Like I don't force people to learn things that they don't want, but I'm willing to share like what I know with the staff so that they then have like a different tool that's available to them. And so as a doula, understand that most of us are probably leaning towards the more holistic, like low intervention side, because that's the type of tools that we have available to us. Like that's the type of stuff that we're going to be really educated on, but also acknowledge that there are times when a medical intervention is helpful, and being able to help navigate your family through whether or not they want to choose a medical intervention, like is incredibly beneficial as well as a doula, without making them feel like they have somehow failed, or that like, this is your only option because, your labor is just awful now. Like you want to help them feel confident in making that decision without feeling like they've been coerced by anybody, without like, starting a fight either with the staff. Like I don't ever go to a birth thinking like I'm going to have to fight like when I get there, because I don't want to create that environment for my clients either. And so if I have that type of vibe going on with myself as a doula where I'm viewing the hospital and all these interventions as bad, that's going to be projected onto my clients too, where they're going to feel more anxious because of me. And so I also have to remember, hey, these are people that are here to help us, and they're open-minded too, and we're going to work together. And this is also a big reason why I choose the type of environments that I support births in. Like there are certain hospitals that I don't go to anymore as a doula because I was having a really hard time being like, they're here to help us, like just based on the type of care that they provided. And so as a doula, I'm like, that's not a good environment for me. I need to kind of limit where I provide support to like specific locations, because I feel most confident that the staff at those locations are there to be a part of a supportive team, as opposed to like, just do what I say. So Roxanne, what are some tips that you have for like the labor nurse that is helping to support a birth?
Well, so like as medical providers, we don't learn, like they don't teach you like pelvic biomechanics and like labor positions that are beneficial, and like all of the like biomechanics and positioning options that are optimal for birth and like can help progress labor. You kind of just learn like the fetal monitoring system, and like you learn on the job like different positions to kind of help how to help somebody push, and all of these things you just learn on the job, or like you like Google and find workshops in your area to learn all of those things. And if you have like a really great person for like your preceptor when you're orienting to a unit, that's how you learn a lot of this stuff. And same with like medical school, like they don't teach you like in-depth pelvic biomechanics of like, hey, asymmetrical movements, move the mid-pelvis. Like,
Yeah.
there's not a whole class on this. So it's on the job training. So I think it's understanding that like our expertise is the medical interventions. And as you become like more experienced as a nurse, like learning all of the pelvic biomechanics and laboring positions and pushing positions and all of these other types of like quote unquote holistic views of labor support is beneficial. But knowing that if there is a doula in the room, like they're not there to like cause like stress or conflict. They're usually there to like help support their patient in ways that you can't. I personally love a doula because I know I cannot be in that room 24/7. Like I have other patients. It's very rare in a labor and delivery unit that one nurse has one patient. Most hospitals are going to have at least two patients unless it's like a good day and you only have one. You're like, well, look at all this time I have. I can hang out in this room all I want. But most of the time I had two patients, and I was bouncing back and forth between the two, and I cannot provide continuous labor support. If someone wanted an unmedicated birth and they did not have somebody, like I would dedicate more time to them, but like I couldn't stay in that room 24/7 because I had to go see my other patients. I had to like take care of them too. So a doula was I was like, sweet, less work for me. I can just focus on the medical portion because they got that other portion. Whereas if I had a patient that didn't have a doula, I would kind of do both. But I've also like learned a lot about like positions that can be helpful, like all of the pelvic biomechanics. Like 8 years is a lot of time to learn a lot of things. And then some are just like freaking intuitive and just know the things like just like, yeah, I don't know how they like just look at a belly and they're like, we're going to do this like in milliseconds. I'm like, you're amazing. Teach me all of your skills.
Show me the way.
But it's also like not every labor nurse loves unmedicated labor support. Like not everybody wants to do that. Like everybody has their expertise. Some people are better at like if someone has an epidural and like getting them into those positions to help labor progress with an epidural. Some nurses are better at that. Some are more like love unmedicated birth a little bit more. And so again, knowing your strengths as a medical provider can be really beneficial to know which births probably you'll be more helpful at and be more comfortable at versus, and then like acknowledging the support that you have, like utilize the people that are in the room. Like we are a team and it's not us versus them. And I feel like a lot of medical providers like see somebody has a doula or see someone has a birth plan and they're like, oh, this is going to be conflict. But it's like
they're expressing a preference that they have based on something that they've learned during their pregnancy that became important to them. And if it's something that you feel is confrontational to you as like a provider, then one, like understand
look
why.
into yourself.
Like look inside. Why does it bother you that somebody has a preference for their birth? And so I think like when it comes to the medical side of support, like understanding like what type of tools you are commonly using that you're educated on is going to be the more like the medical interventions. And so similar to like with a doula, where not everything is going to be solved with a low intervention holistic manner, not everything is going to be resolved with a medical intervention either. And so again, being open to exploring either side and utilizing all the different people on your team is going to be super beneficial, and acknowledging that everybody has a different dream birth. They have a different vision for themselves and their birth experience. And even when they begin to navigate their experience, they may be like, oh,
I'll change my mind.
This is a little different. So even just for me at my home birth, because everyone, like the one viewpoint that I'll typically see that falls very far on like the give birth and meadows is you shouldn't have to push your baby out. You should just, your body will just do it for you. Just breathe the baby out and they'll just fall into your hands. You shouldn't only be in an upright position while you're pushing. And so even with all my experience, I, in my head, was like, I am going to catch my own baby and I'm just going to breathe her out. I don't know why I convinced myself this is what my birth was going to be like, because none of my other ones have been like that. So maybe this one will be it for me.
Hypnobirthing.
I was like hanging on for dear life. And what I needed to do in that moment was lay the fuck down, because I could not relax in an upright position because it was too overwhelming of a sensation for me. I was not like, oh, it's time to push, like, or anything. Like, my body was like, like, I was just hanging on for the ride. So yes, my body was pushing for me. I did not need to push. Like, Gina did not consciously. Gina did not have to consciously be like, okay, now I'm gonna hold my breath and bear down. Like, my body was doing it for me. So yes, that did happen. There was no gentle breathing my baby out. It was like a roaring, like, kind of holding my breath, kind of grunting. Like, it was very loud as my baby was coming out. And it was like pretty much on my back, because that was the only position that I could get into that I felt like I could relax in. And so I did not like gently breathe my baby out. I could not catch my baby because I was just like hanging on to whatever was nearby at that point, just hanging on for the ride. And I gave birth at home. And so all of the things that people say is like the best way to give birth, I did not do that. And I had a no intervention birth at home. Like, I thought I should have the perfect birth, which is just breathe and my baby falls out of my body. Like, that did not happen. And so I get really irritated when I see stuff from the super crunchy side that pushes this, like, this is what your birth should be like. And so when somebody does something different or something intuitive happens for them that's different, then they feel like they did something wrong. Like,
like pushing on your back.
I was on my back, and that's why, if they tore, they're like, oh, that's why I tore, because I was on my back. It's like, well, if that was the most comfortable position for you, then by all means. But on the other end of the spectrum, where it's like, you need to be flat on your back with your knees super wide because this is the most comfortable position for your provider to catch your baby in. And therefore, like, we don't really care what position you think you want to push in, you're going to push in this position. Or if they're like, I think I want to explore sideline pushing because I was told that has the lowest risk of tearing and I would really like to prevent tearing. They're like, we can try it. It's like, oh, I feel supported. And so there is the other end of the spectrum where it's like, why would you do anything different than what we tell you to do?
Yeah.
Like, and so finding that middle ground, like we've been talking about this whole episode, of understanding there are a lot of different options available to you during your birth. There's a lot of different options available to our patients and to our clients as birth workers, and being open to understanding, one, what are your biases? What side are you leaning a little heavily on? Can you somehow try to make your way towards the middle a little bit? Now, yes, of course, for me, my first go is going to be a low intervention or holistic option. Like, that's what I'm going to start with. Like, if someone's having a stall, I'm going to start with the movement. I'm not going to be like, Pitocin! Like, but for somebody that's on the more medical side, they may be like, well, let's try to get your contraction stronger. That may fix your baby's position. Like, that may help kind of push the baby where we need it to be, which is a valid option as well. And so understanding what your biases are, which side you're leaning towards, and then understanding that there's another side that has different options available that could be, if not more beneficial for your client or your patients, and your person that you're supporting may be on the other side of you. They may be leaning towards the more medical side or the more holistic side. And so you may have a little bit of a conflict there where you're like, well, why are you scared of Pitocin? Like, what do you mean? It's just Pitocin. Like, and which was similar for us. Like, we were leaning on two different ends. Like, you were trying to support me and I'm like way over here, like terrified.
So one thing with the two extremes is that, like, when you were on one of the extremes, like when we were at the beginning, like we were on two extremes, like acknowledging that, like, we grow as people and that we can learn to come to the middle, and that just because your view has changed or like the things that you do are different, it doesn't mean that like the old you or like your old views were like you were a terrible person because you had these views. You've just learned and grown and now are different and potentially are better for your clients. But like when we have these like new information that comes out that like, hey, like maybe we need to come to the middle and like be like change a little bit. It's hard for a lot of people to change their views and come back to the middle because they're like, well, like shit, I was kind of a dick, or like, hey, I was kind of doing things wrong. Like I unknowingly was so harmful to all of these people's births, but like you didn't know what you didn't know. And now you know better. And so now we should do better. The hardest part is when you learn that things are better and you don't do them. That's when it's bad, because you're like, well, this is how I've been doing it all this time. And if I change, that means that I was like fucking up before. But no, that's like, change is a good thing. We should all be changing constantly. We should always be learning new things to be better. And by being better, we're coming to that middle to provide better care and have better birth experiences.
So when it comes to birth, there can be some polarizing viewpoints. On one end, we have the no intervention side, and then on the other end, we have everyone needs every intervention that's available to you. Understanding where you fall along the spectrum and what type of information that you are receiving during your pregnancy and what side that information may be coming from can really help you navigate your pregnancy more confidently, navigate your birth more confidently, and then into the postpartum as well. So it's important that we're consuming content and information that is aware of their biases and understand what side maybe you tend to prefer information from, and then also what our own personal biases are, and that of our support team as well. If you are a birth worker and you're supporting someone in birth, it's also important to acknowledge where you fall on that spectrum and how that may differ from other people on the support team to include your clients or your patients. And so when we have an open mind when it comes to birth, we don't mean be open to changing your mind and not having your birth plan. We mean being open to understanding that there are a lot of options available to you, and there may be a specific one that works best for you and your family that may or may not be completely aligned with the end of the spectrum that you may be receiving a lot of information from. When I reflect on my own first birth experience, the thing that makes me the most sad is that I somehow felt that I had failed my baby and my birth experience because I didn't completely align with the end of the spectrum that I was receiving information from. And that was a really bad place to start my postpartum experience. And so that's why it's so important that when we are consuming information during our pregnancy, and if we are the one presenting information, that we understand our biases and we try to present it with an open mind, allowing people to make decisions that work best for them and their families.
So we're obviously a little biased that we think our childbirth education is the best on the market because we do have the two different perspectives to kind of provide as much of an unbiased approach to birth, because we have the medicalized side with me and then the doula side from Gina.
In addition, we're both perinatal fitness trainers, and so we offer that perspective as well. So there's a lot of different viewpoints that are going into our childbirth education course. And while we are biased, we all have our own biases. Because we're able to combine these different perspectives together, it helps ground the two of us a lot better. Like Roxanne pulls me from my end of the spectrum, and I help bring her to the center as well, because we understand that people have different points of view and that it's important to share these different points of view so that you can make an informed decision that works best for you and your family without feeling like you've done something wrong. So if you want to check out our childbirth education course, you can check it out on our website at MamasteFit.com/childbirth, and you can bundle it with our prenatal fitness programs to save 15% as well.
And if you're in the postpartum, we want to have postpartum fitness programs that you can return back to fitness after having a baby in a slow, gradual, intentional program, as well as education courses that is bundled with postpartum and newborn what to expect that also has infant massage and infant and toddler CPR.
If you're a professional, we do offer a birth workers course and a prenatal postpartum fitness trainer course that you can check out on our website as well and earn CEUs.
And as a thank you for listening to this entire episode, you can use Story10 to get 10% off any of our courses as well as bundles to basically make it free. This podcast is sponsored by Needed, a nutrition company focused on the perinatal timeframe that we have both utilized during our preconceptions, pregnancies, and postpartums, and as well as our husbands have utilized their men's line. And you can use code MamastePod to get 20% off your first order or the first 3 months of a subscription at thisisneeded.com.